Hello, welcome everyone. Beautiful day here in sunny Florida. Let's go ahead and take us off here. We can then see through here as we send our notifications out. We're going to be discussing a very important topic today, all about how forward head posture damages the head, the neck region, as well as the TMJ. So we're going to touch a lot about TMJ. Hello there, Devan Shu. You are our first person out there. We're starting to send notifications out right now, and we'll continue on. But this is a great program, and as the programs have been really intense, but this could be a little different. We've been spending a lot of time about nutrition, a lot about like magnesium, going into vitamin K2, talking about organic coconut oil, apple cider vinegar. But today is going to be a little different. We're going to go back to our forward head posture. Hello, Sandy, Ali, Gail, Blockhead. Hello, nice to have you here. And so as we continue to move on, this is going to be a very interesting topic. I'm going to show you biomechanics. Nothing like this is on the internet when it comes down to YouTube. So I'm going to go ahead and make it quick. We're going to kind of go through there. Hello, my friends. Thank you for being in the chat room with us. I just want you to understand the importance of what we talk about of TMJ. But first, I want to talk about some important things about forward head posture, poor posture, like sitting at a computer like you guys may be right now, or at work or during the day, and you can realize that you're hunching over all day long, the head's going forward. If you look at this, that kind of brings back a little bit of memories, because you can see the right way versus the wrong way. Making sure that your feet are on the floor, you got proper ergonomics, so much away from the terminal, have a support behind your lower back. That all makes a big difference that you get out of that slouching habit. I want to go into a little bit before I go into the TMJ to give you a little bit of understanding. We look here of the TMJ joint. And this thing can cause lots of problems. Anything from ringing in the ears, tinnitus, to facial pain, to headaches, to clicking in the jaw, to facial pain, to even neck pain. And I'm going to explain this, and we're going to kind of go through it. You're going to kind of really appreciate this kind of stuff because it's really different. When I say different, it's something that you don't normally find on the internet and you don't normally read up on. Now, if you notice, how many people like you do this on a regular basis? All right, we get our phone like this, our smartphone, whatever phone we're on, and we just spend so much time. This is a major problem. That this is what's causing this forward head posture, deformation, degeneration, disc degeneration, herniated disc, bulging discs, osteoarthritis. All those problems are occurring in the neck, and you're going to say, well, what am I talking about? Well, let's look at this right here. Here's a young fellow, okay? Look at this x-ray, forward head posture, developing a sway back, bad posture in his mid-back area. He's hunched over. He's already developing degeneration where that arrow is on the left, and that disc is degenerating. You can't regenerate that disc. And that disc continues to degenerate. You're going to start getting pressure on the nerve. The disc is going to get weak. You're going to start developing a herniation or a bulging disc. You're going to have problems. Forward head posture is a serious, serious problem. For those people who just tuned in with me, you can look on my channel. I have more videos on forward head posture than anyone on YouTube. And I advise you to go there. If you notice that your head is in a forward posture, and by the way, as we talk about this, I want you guys to look at me for a second, and let's do this test real quick together. Let's take our first four fingers, our fingers like this. I hope you guys can see me, and put it against your hyoid bone, that little bone, or your thyroid right there. Okay, put it on. Do it with me right now. Now, what I want you to do, I want you to take your pinky and move it up and down. Okay? Now, what I'm trying to tell you is that if your pinky's not hitting your chin, your forward head posture, it means you're over here. You see, what's happening is that it's not meeting it. Okay, when it's back here, it's going to hit it, but as you go forward, it's not going to hit it anymore. So what I'm trying to get you to understand is you need to look at your ears and make sure that they're sitting over your shoulders, and make sure that if you're spending time looking down on a computer, texting, whatever you're doing, you need to jut the chin down. You cannot be in this forward head posture, okay? Because what's going to happen is that you're going to wear and tear a lot of problems around the neck, into the facial area, and particularly the TMJ is what we're going to talk about today. All right? The TMJ is a serious problem. And if you look at the symptoms here, wow, I mean, this is pretty intense. Head pain, forehead pain, headache, shooting pain in the back of the head, pain behind your eyes, even in your mouth, your jaw deviating, your jaw clicking, your jaw just giving you problems, popping sounds. Neck problems, throat problems, difficulty swallowing. Why? Because we're gonna touch on this, and I'm going to show you why, and you're going to wonder why a lot of these symptoms that you're having are all related to forward head posture. So you can go to the dentist, orthodontist, the oral surgeon, the ear, nose, and throat, and you can get all these types of diagnoses, but if you don't correct your forward head posture, you're going to have problems. So this is a wake-up, guys. It's definitely a wake-up. We look at the muscles. We're going to come back there in just a second. But what I'm going to do here right now, I want to go to a very important area, and I'm going to kind of jump the gun a little bit. But this right here is probably one of the most important pictures we'll look at. All right? Now, I want you to look at this picture right now. Most people who are forward head posture, they're usually mouth breathers. Now, what I want you to do, guys, you're going to do a little test with me. I want you to bring your head forward. Just go ahead and exaggerate it with me, okay? Now, what I want you to do, I want you to bring your head forward and shut your mouth. Really try to close your mouth. It's hard. It's almost impossible unless you really force it. So generally, when you're a forward head postural person, it's easier for the mouth to stay open because the muscles aren't allowing the jaw to close. So that takes us to a very important thing. So when the neck and the head is jutted forward, these tensile forces underneath the what we call the hyoid or the digastric muscles, if you look at those hyoid muscles, those muscles basically are there to elevate the hyoid bone, okay? It elevates the muscles, it pulls up. It actually helps open up the jaw along with the lateral pterygoid. All right, now I want to just kind of skip around here for a second. I'm going to come back to this. But if I come back here, all right, because this is a little complicated, but I just want you to understand about opening and closing. If you look to the left side there, you see the hyoid muscle and you see the suprahyoid muscles. Those suprahyoid muscles, when they contract, look, it pulls the jaw down. You can watch me. Watch what it does. As it pulls up here, it shortens. And as it shortens, it opens the jaw like this. Okay? The lateral pterygoid inside the mouth, when it contracts, it opens the mouth. Okay? Now, if you look at the right side, the medial pterygoid inside the mouth, as well as the big muscles, which I'm about to show you, the masseter muscles in here, the temporalis muscles, they shut the jaw. So those muscles are much, much, much stronger. You with me? All right? It's kind of like a pit bull. That's the masseters. Those are the big, big, strong muscles. Okay? So I want you just to grasp that just for a second. So we'll come back to this picture right here. So what happens is when you're forward like this, these muscles start to overwork, okay? And you get this, the TMJ, the mandible, starts to translate going back and down. It's a condition called jaw retrusion. And so when we get this jaw retrusion, the brain starts to process this. And what it wants to do now, it wants to allow these powerful jaw closers to come into play, the temporalis, the masseter, the medial pterygoids, and there becomes a fight between these muscles and these muscles. But what happens is when your jaw is down, the occipital muscles underneath the skull start to contract. The brain tells it to contract because look what happens when you're forward. You're looking down. So when you're forward, you want to look out at the horizon, so the occipital muscles have to contract. Watch my head. It has to come up. So now you got this suboccipital region. These muscles start to overwork, causes headaches, problem behind the skull. pain over the head behind the eyes, visual problems. These nerves, called the greater occipital nerve roots, come over the head behind the eyes. So from this, we get problems back here, we start affecting over the head, and now we got problems behind our eyes. So it's a whole vicious cycle. So this is something that's really important. And what actually happens as well, from the jaw, we get a direct response on the nerves that affect, believe it or not, the spinal accessory nerve that affects the upper trapezius and the SCM. So we get reflexes going back to these muscles, and we get this now. We get our traps contracted, we get our muscles going forward like this because the SCMs is just squeezing, and we get a whole roundabout cycle because these nerves are so complex. When we have one thing going on, the body's always trying to compromise and compensate for that imbalance. That is so, so important. And so you're wondering how this can cause this, how this can cause this, and how this can cause this. And it does. It works hand in hand. So if I go back to this picture and I show you that the nerves around the jaw, how they are affected, nerves affect vessels. When nerves aren't functioning right and they're irritated, the vessels become, you get pressure on the vessels. You can then get tight muscles, irritate the nerves, and we start getting a whole vicious cycle of pain or headaches. So it's a whole vicious cycle. So when we see this, the chronic forward head posture, it's affecting all these muscles. Look how it affects the sternocleidomastoid, the anterior scalenus, all back underneath the skull from those occipital muscles, from that chronic forward posture. It puts a tremendous burden, a tremendous weakness and stress on those particular areas. And you can see here in this picture right here, basically the changes that take place, all right? Because this does affect those muscles of the jaw. Those are our chewing muscles. We have the deep muscles, superficial muscles, the masseter muscles, the real thick muscles, the pterygoids and the lateral pterygoids. You can come back to this. This will be posted on my channel. And that is something that I just want you to get a better understanding what's happening in here, because the clicking, the pulling, the tightness, the headaches, the deviation, all that kind of stuff is affected by these muscles from forward head posture. And very few people are teaching this because I don't know why. Here's our SCM and our trap muscles that are kicked in because that spinal accessory nerve is involved as a result of this whole complex thing going on. There's a suboccipital muscles underneath the skull. You have nerves that go over the head behind the eyes. Very common. You can Google that. It's a very, very common thing. So this poor posture type of thing, you really need to be aware of it, and I think it will really help you a lot. You can look at many of my videos on forward head posture of all kinds of exercises, stretches, things you need to start doing, like the chin tucks, like the rhomboid exercises, like stretching the chest area. You can use the bands. There's so many different exercises. You need to go through those. Hello, Sarvit. You need to go through those, and you need to look at that and learn that it is so important, because forward head posture will destruct the body. Now, what I want to also show you guys, we look at the muscles. One thing here, let's get to it right here. We showed you the muscles. Let's go to this right here. Now, it's maybe a little harder for you to see. You may have to blow it up. But what this is about, this is a little exercise, and it's called Zia Guan point ST7. And basically what we do here is that if you're getting pain, particularly in the jaw area, what we're going to do is that we're going to, you can go through this, but basically what we'll do is we'll take our finger as we open the jaw up like this, okay? We'll put our finger right in that groove behind the jaw, all right? But you want to keep your tongue pressed against the hard palate behind your teeth, the top teeth. And then when you open up, you hold it in there. And then while your mouth is open, you can kind of feel an opening when you're in there. Then once you're in there, you can basically open and close your jaw slowly. And what that does, it helps align the TMJ. But when you open and close it, don't go side to side. Try to just go up and down. Try not to deviate your jaw. Because sometimes when the jaw becomes off from the condyles, just by opening and closing, you can then bring normal physiological mobility back into that jaw all by itself. Now, the other thing I want you to do, guys, when it comes down to TMJ, I want you to, let's see if I can find the other picture for you. This is basically the trigger points of the masseter muscles. This area right here, okay, you can see that if you take your thumbs and you go inside here and you go in little circles, it's going to be real sore. It's going to be hot. It's going to be real tender. And those points that are tender, I want you just to rub in little circular motions and go to a different area. By releasing those TMJs, which is kind of like the pit bull muscles, those are the strongest muscles, probably like almost in the whole body. Those muscles is what clamp down and clench down. That's when you chew, that's when your mouth closes down. But if you can release those muscles, and we get a lot of that problem from stress, from that forward head posture, from anxiety, from just, putting a lot of excessive stress in our system, that causes those muscles to really tighten up. That's why a lot of people may grind their teeth at night, bruxism. A lot of times your dentist may give them a plate, but you need to release those muscles, and you can really do that on your own. So that is pretty much what I really wanted to go into with you guys today. I think that this is a real good, short to the point video, and I really hope that it will do you a lot of good. I ask you to subscribe if you haven't, and go through my videos, share these videos. This will be put on my channel in about the next few minutes, but I will be making a couple edits, so you can go there, look back, look at the charts in there, look at the muscles. But remember, when this happens, these muscles kick in. These muscles' job, obviously, is to lift, is to contract, to bring the jaw down. Okay? You got these muscles fighting you, because when the head is down, the occipital muscles need to allow you to gaze, to look ahead. These contract. When you get the whole vicious cycle going on here, it affects nerve roots, and these nerves, obviously the spinal accessory, the cranial nerve, will affect the trapezius and the SCM muscle, causing those muscles to become inflamed or contract. So yes, the question here is, you can have a problem in one area as a result of this and have several different symptoms going on. But I advise all of you to really start watching that forward head posture, start correcting it, because this will help you tremendously, guys. I'll go to the chat room right after this, answer some questions. And again, God bless everyone. Thank you for coming to the chat, and we'll catch up with you real soon.